the worst days of the pandemic ahead of us? Are we looking at a nightmare January, do you think?
I think we're looking at a very challenging January. One has to look at this in perspective, I think, compared to last year. You know, if you had the same number of cases right now, we would be in total lockdown. I think the vaccines have been of enormous help in preventing hospitalisation, admission to ICU, severe illness. There's no question about that, and the evidence is very clear. So the fact that we have a very robust booster campaign now with a lot of momentum, I think will give us significant protection. And so I think we can get through this. It's many twists and turns in this, no guarantees, one cannot be certain, but I think the combination of the booster campaign with modification in our behaviour, with the restrictions that have been introduced, if you combine all of that, I would like to think that we would be in a better position compared to last year in the context of a new variant arriving on the scene.
Do you think it's possible we'll get away without having more restrictions? I'm not talking about in the coming days, but I'm talking about, say, when we get into January. Is it possible we won't need more restrictions? Because I think most people are kind of assuming there will be more.
Well, I think I'm watching what we did during Delta, and there was a period during the Delta when we thought we were in a bit of difficulty, particularly as the numbers creeped up in ICU and hospitalisation, and we asked people to work from home. We asked people to reduce the level of socialisation, and we know from research that people did that themselves and significantly reduced the appointments they had. They cancelled appointments, and that did result in the stabilisation of the Delta figures. We were winning over Delta. Along comes Omicron. So what that demonstrates is that if we could reduce socialisation by 20 to 30%, that's the aim of public health officials, then we can manage this, combined with a high momentum booster campaign, which really is going very strongly now over the last week or so. Very high numbers again last evening, 75,000 recorded yesterday between boosters and third doses. So that's really moving. So I think we if we go along the route we're going, I think we have a very good chance.
Okay. Schools, we're getting a lot of texts in from people saying, I left my kids home from school today, and sort of questioning the decision not to close the schools last Friday. Do you understand those concerns?
I do. I mean, I can understand many people's concerns and commentary in relation to various aspects of this. We did discuss this with public health. They were clear that the numbers actually were stabilising in schools over the last week or so. But also, if you start now with the schools, what's the rationale for reopening if you think there's a problem? The advice we're receiving right now is that there's not a problem or evidence to suggest that we should. So we're keeping...
Because people will say, of course there's evidence. Sure, there's loads of kids in my kids' school who have it and they're passing it on and so on.
Yeah, I mean, and there has been, we know from the 5 to 11-year-olds, particularly latter part of November through early December, numbers are going up very high. Now, the public health have a perspective on that, and they've looked at the data and they believe there was a very significant level of community transmission, particularly during the Halloween break. But let's look at the other side of this, that for children, for many children, school is critical. For the development of the child overall, children need to be in school. So our overall objective is to maintain routine for children and also maintain the atmosphere, the environment where they can develop the best in terms of all aspects of their health, mental health, socialisation, and so on. I worry about the impact of COVID-19 on children, even children born at the beginning of the pandemic. Their level of socialisation in the first 2 years has been much less actually than children ordinarily would have, and I think our childcare services, our early developmental services have to be really beefed up now in the next while to really deal with the impact of COVID on children, and school is a critical weapon for us to protect children and to enable them to develop with their friends in the best way.
We were talking to Liam Fanning, obviously an expert in this field, a little earlier on the programme, and he was making the point, he was saying, look, it isn't really conceivable that we, like, say, go into 2022 and into next winter, the winter after this one, with more lockdowns and so on. And he was making the point that the numbers of people in ICUs who are unvaccinated, and he said, I think it's time, and he went no further than this, but he did say, I think it's time to have a discussion about mandatory vaccination. Do we need to have that discussion?
I'm personally of the view that we stick with the voluntary system. It has worked in Ireland more than anywhere else in the world, at 94% now. fully
It's a
vaccinated.
hardcore 6% though.
No,
And
but what is that telling the world? I mean, you go across Europe, you're looking at 60% vaccinated.
Yeah. No. We've done brilliantly.
No, but I mean,
We've
there's a
done
message there, isn't there? Some of those countries are now talking about mandatory vaccination. There's no guarantee that will work, by the way, in itself. I mean, I was listening to one Prime Minister talking about fines of €600 every 3 months. And that's what a mandatory regime looks like. In my view, I think we have to keep pushing the voluntary approach, which has achieved an enormous amount. I do get the point that the unvaccinated take up a disproportionate element of the health service in terms of the ICUs and in terms of getting severely ill. We have learned in terms of targeting the latter part of the vaccination programme, the last 2 or 3%, that in some instances it really meant targeting particular groups where there would have been maybe a historic resistance to vaccination, had come from other countries and so forth, where that would have been present. On balance, I think we should keep going with the approach that we've adopted so far.